Welcome to the Municipal Health Insurance Consortium. This presentation will provide an overview of the Platinum Plan benefits. What is the consortium? We were originally formed in Tompkins County to establish a high-quality, cost-stable health insurance for municipal employees and their retirees. Since then, we have grown, and we are now offering health insurance available to offer health insurance in 18 different counties, currently serving 87 municipalities across 14 different counties in central New York. We are a self-funded municipal cooperative, governed under Article 47 of the New York State Insurance Law, managed under the adoption of a municipal cooperative agreement, which every one of our municipal members signs. We're obligated to adhere to specific New York State and federal health insurance mandates, such as a municipal member, you have to offer COBRA coverage for 36 months instead of the standard 18. We have a large risk pool, which helps keep our premium rates low, and we can handle high and low claims by having a larger risk pool. Our municipal members are our owners. Every municipality has a seat on our board of directors, as well as we have 10 labor seats on our board of directors and include labor in all of our subcommittees. As you can see, we span a large portion of central New York, covering 8,500 lives currently in 2026. Originally, we were formed in Tompkins County, bringing together all of the municipalities in Tompkins County, including the county, to form the consortium. We continue to grow in various other counties, with our recent additions of Livingston and Monroe being new territory that we can offer health insurance to. One of our best forms of marketing is our members. Feel free to reach out to them if you have questions about the consortium, our membership, or our benefit support. Now to get back to the Platinum Plan benefits. These are the 2026 Platinum Plan monthly premium rates. These are the total rates that we bill the municipalities. This is not the total rate that's taken out of an employee's paycheck. What comes out of an employee's paycheck is their cost share. So individual rate is $1,127.82. Family rate is $2,932.39. We offer two-tier plans, which means it's either single or family. Anything above just the subscriber enrolling is considered family tier. Before we talk about health insurance, it's important that we all understand these terms. A deductible is the amount of money you would have to pay out of pocket before the plan would start covering certain services. So for example, on the Platinum Plan, there is no in-network deductible, but there is an out-of-network deductible that would need to be met before the health insurance kicks in and starts paying a portion of the claims. Out-of-pocket maximum. The out-of-pocket maximum is the amount of money you would have to pay in a plan year for all services combined, after which the insurance would cover all eligible expenses at 100% for the remainder of the year. So it adds up every copay you're paying at the doctor's or the pharmacy, and once you've met your out-of-pocket maximum for the year, you have 100% coverage. In and out-of-network have separate out-of-pocket maximums, and by no means do you have to meet this number every year to ensure coverage. It's not a deductible, it just is a catastrophic. So if you have a large medical need for that year, the most you will pay in that year is your maximum out-of-pocket. Coinsurance, the percentage of cost of the service you pay out of pocket. So for example, on the Platinum Plan, durable medical equipment is covered at 80% and you pay a 20% coinsurance for that item versus a copay, which is a set dollar amount you pay out of pocket for a service. For example, if you go to an in-network primary care doctor, your copay is $15 every time you go to that doctor, not a percentage of the visit like a co-insurance. These are the deductibles and maximum out-of-pockets for the Platinum plan. In-network deductible for the Platinum plan is $0. Out-of-network deductibles are $1,000 individual, $3,000 family. Maximum out-of-pocket, so this is all those co-pays and co-insurances adding up to this total. Once you reach it, you have 100% coverage for the rest of the year. In-network is $3,000 individual, $6,000 two-person, $9,000 family. Out-of-network is $5,000 individual and $10,000 family. All the benefits shown here are for in-network benefits. If you're looking for the total in-network and out-of-network benefits and how that all correlates, you're welcome to visit our website, which is at the end of this presentation, but it's www.healthconsortium.net. All of our benefit plans are listed there, and you can see the full benefit summaries to review. Preventative care such as colonoscopies, mammograms, well child visits are all covered in full under the Platinum plan. Primary care visit is a $15 copay. A specialist visit, like an endocrinologist, cardiologist, is a $25 copay. Outpatient mental health and substance abuse visits are a $15 copay. Urgent care is a $40 copay. For example, visiting a WellNow clinic is an urgent care and would be a $40 copay. Diagnostic and routine x-rays are a $30 copay, and so is advanced imaging. Ambulance and emergency room visits are a $250 copay. An inpatient hospital stay is a $350 copay. If you go to the hospital, to the emergency room, and they end up admitting you as an inpatient hospital stay, you will not pay both copays. You will only pay the inpatient hospital stay copay. The $350 copay is per stay, not per day, which means you could be in the hospital 5 days, it's still only $350. You could be in the hospital 20 days, and it's still $350. Pre- and post-op natal care is covered in full, so is routine newborn nursery care. Maternity care, such as the birth, is still a $350 copay for that inpatient hospital stay. Skilled nursing facilities is a $350 copay with up to 200 days per year. Skilled nursing facility does not mean long-term care placement, such as I can't live on my own anymore. I need someone to give me constant care every day. It's for acute care. I fell, I broke my hip, I need more time in the hospital to recover and get my PT and my care in so I can go home and successfully be independent. That is skilled nursing, the acute care. Outpatient rehab like physical therapy, occupational therapy, or speech is a $25 copay with 60 visits per year. Outpatient surgery, also known as same-day surgery, is a $150 copay per surgery. Radiation therapy is a $25 copay per visit, and chemotherapy is a $15 copay per visit. Dialysis is covered in full. Hospice and home care are covered in full as well. Chiropractic care is a $15 copay per visit. Acupuncture is a $25 copay, up to 10 visits per year. And durable medical equipment is covered at 80%, and you pay a 20% coinsurance. Durable medical equipment is more than just hospital beds, walkers, and canes. It also includes CPAP supplies. It can include oxygen machines. It can include CPAP machines. Those are all considered durable medical equipment as well. The Platinum plan also includes vision and hearing benefits. An adult or pediatric routine eye exam is a $25 copay, allowed one per year. Adult eyewear allowance is a $100 allowance per year. The pediatric eyewear allowance covers eyeglasses, frames, and lenses at 80%, leaving a 20% coinsurance to you. Routine hearing exams are covered at a $25 copay, and hearing aids are covered at 50%, one purchase every 3 years. The purchase can include a pair of hearing aids. They just need to be billed at the same time. Pharmacy coverage. So to fill a medication at a retail pharmacy, you're allowed up to a 30-day supply. A tier 1 medication is a $10 copay, tier 2 is a $35 copay, and tier 3 is a $70 copay. You would find out which tier your medication is by visiting our website. We have the formulary link there, and you could just search the document for your medication name. We do have an open formulary, which means all medications are covered. The more expensive medications, like a name brand medication, typically falls into a tier 3. Most generics fall into a tier 1. We also have 2 different mail order pharmacies that we'll go over next, but you can receive up to a 90-day supply of your medication through one of our mail order pharmacies at a 2 30-day copay rate. So it actually helps save you one copay out of that 90-day supply. So a tier 1 would be a $20 copay, a tier 2 would be a $70 copay, and a tier 3 would be a $140 copay for a 90-day supply. On the back of your ID card, it'll show Express Scripts as your mail order pharmacy, but we actually have 2 available. You can either go through Express Scripts or Wegmans Home Delivery. Both work very well. They're both in network pharmacies, and they'd mail a 90-day supply of your medication right to your door. One of the items that the consortium prides itself on is member support. We have a direct customer service line with Excelis listed here at 1-877-253-4797. That number is also listed on the back of your ID card. You can reach out to them directly, put in your ID number when it asks for it, and that will send you right to a customer service representative that's familiar with our consortium plans. We build our own plans here, and then we contract with Excelis to manage our medical and prescription benefits. The consortium also has its own benefits team available to handle and investigate any member issues, including claims, benefit questions, and comparisons. We have a direct email to our benefits department at hcbenefits@tompkins-co.org, or you can call our main line at 607-274-5590. Option 2 is the benefits department, and then you can select either to talk to our benefits specialist or our benefits manager. We also list all of our benefit information on our website, as I mentioned before, and we're available to host employee informational meetings, either virtually or in person. And we ask that all of our municipal members host open enrollment every year in November to allow their members access to change enrollees or enroll in the health insurance. We also, as part of being a municipal member of the consortium, we offer a free wellness program to all of our subscribers and their dependents. We send out monthly wellness emails with wellness challenges and educational webinars. We also host Blue for You clinics every year in the spring, which is a free fasting blood draw, biometric screening available to anyone on our metal level plans. For the subscriber and their spouse or domestic partner to participate in. They can be right out at the municipal members' locations, so it's easy and accessible to your employees to have access to that. And we also try to promote the other Excelis tools like Blue for You, WellFrame, which is free case management, access to dietitians, nutritionists, and everything through the WellFrame app, as well as all the other features that we have access through Excelis. We maintain a Facebook and an Instagram page, which are very wellness program heavy, trying to increase knowledge and education about healthy living habits. To register to receive the Consortium Wellness emails, it's pretty easy. You just visit our website at www.healthconsortium.net. Right on the main page, you'll see kind of a little newsletter button that's shown here. You click it and you complete the registration form and you can sign up for the Consortium Wellness program. You can also subscribe to our newsletter right when you're entering all that information as well. We also offer a free program. It's a voluntary prescription drug program through CannaRx to all of our members. You just become eligible by being a member on a consortium health insurance plan. And they carry a very large list. This is just a fraction of the list that they actually have of medications that are name brand that are zero copay when you get them filled through CannaRx. You can either visit their website and see if they carry your medications, or you can call their customer service and they can check your medication list with you. Their customer service phone number is 1-866-893-6337, and their website is www.cannarx.com. And sometimes it may ask for a plan ID. You can put in GTC MHIC, and that'll take you directly to our landing page with them. The consortium headquarters are located in Ithaca, New York, and feel free to visit our website to learn more information about your plan. And you're welcome to reach out to us to ask any additional questions about your benefits, your plan, or any other questions that may come from you as a member or your employees as you are a municipal partner. Thank you so much for watching this recording, and reach out if you have any additional questions.